Hi, I'm Dr. Andrade. I'm an adult neurologist focused on genetic epilepsies. I'm going to talk to you today. Let me share the slide about presentation and management of adults with Dravet syndrome. So here are my disclosures. And let me just start by saying that we don't know much about adults. For every 7 studies in children, there's only 1 in adults. But we do know a few things. So this is from the last international consensus on Dravet syndrome. And it shows us that some seizure types tend to disappear, although other ones will still be the same. And there was no consensus for a few of them. But just as a rule of thumb, adults with Dravet syndrome have rare seizures during the day, unless they are napping. In fact, most of their seizures are restricted to sleep, including the daytime naps, and most of them are convulsive, either tonic or generalized tonic-clonic. Most seizures in young adults, most patients will still have myoclonic seizures when they are young adults, but it tends to disappear as they get older. Same goes for absent seizures. In general, adults are less sensitive to fever, even though they can still have fever-induced seizures. And status epilepticus is way less common than in children. However, they can still happen, and unfortunately, sometimes they can lead to a loss of previously acquired skills. In terms of seizure management, it's important to remember that the goals are to maximize quality of life while decreasing side effects of medication. It's important to control the convulsive seizures because they are the ones that have greater impact in quality of life as well as higher association with SUDEP. Remember that Dravet syndrome is associated with a high prevalence of SUDEP, unfortunately. So this last international consensus agreed that first-line treatment for Dravet syndrome is valproate. Second line includes fenfluramine, stripentol, or clobazam. Third line is a pharmaceutical grade cannabidiol. And topiramate ketogenic diet is fourth line. It's important to avoid sodium channel blockers like carbamazepine, oxcarbazepine, lamotrigine, and phenytoin. There's some asterisks for phenytoin. I will explain later why. So for adult neurologists that are not very familiar with some of these drugs, just a few notes. If you start stripentol in an adult that is stripentol naive and is already on valproate, you should be a bit extra careful. Some of these patients can develop hyperammonemia, but the good news is that you can manage this hyperammonemia with carnitine in some cases. So it's important to remember to decrease the dose of valproate before starting stripentol because these medications interact. But in some cases, even when you decrease the valproate dose, you might still get some hyperammonemia. Remember that children usually can have a much higher dose of stripentol. For some reason, it's slightly less well tolerated in adults. Regarding fenfluramine, remember some common side effects, which include anorexia and weight loss, as well as a bit of sedation in some cases. In younger cohorts, there was no report of cardiac valve disease. We are not so sure about older cohorts, but probably at the low doses that are recommended also, there might not be. But it's important that these patients are required to have echocardiograms every 6 months. As I said before, remember that stripentol may increase the serum level of clobazam, valproate, and fenfluramine. In terms of diet therapy, adults tend to tolerate the modified Atkins diet much better than the ketogenic diet, which is mainly reserved for children. And it's important to ask about catamenial seizures, which could be treated with acetazolamide or hormone therapy, or even anti-seizure medication on a PRN basis. So some experts will give clobazam for a few days before and during the menses, or depending on when the catamenial seizures come. Again, important to remember to control, especially the convulsive seizures. These patients are at high risk of SUDEP, and convulsive seizures are associated with SUDEP. In terms of status epilepticus, it's important to remember that every patient should have a seizure emergency protocol saying what to do, when to call an ambulance, when to go to the hospital. So usually the patient will take 1 or 2 doses of benzodiazepine before having to move to the next step. And what are these next steps? So IV valproic acid load, except that patients that are already on valproic acid maintenance, this might be a moot point. IV levetiracetam load, again, not a good idea for those patients that are already on levetiracetam maintenance. IV phenytoin or fosphenytoin. So here is the interesting part. So this is not really contraindicated in an acute situation, an acute emergency situation like status epilepticus. Other options include IV midazolam and phenobarbital load. Patients with Dravet have several other comorbidities. In adults, we usually see moderate to severe intellectual disability, attention problems that sometimes can respond to psychostimulants, autistic manifestation that usually is underdiagnosed, insomnia, which can respond to melatonin or clonidine, or sometimes daytime sleepiness, which can respond to psychostimulants in a few cases. The other problem is Parkinsonism, which is often characterized by bradykinesia, anticholis, and postural instability, which might respond to carbidopa, levodopa. The Parkinsonian speech dysfunction, which might respond to some speech therapy. And other forms of gait problems, including ataxia, crouch gait, and Parkinsonian gait. This is a quick example of adults with very abnormal gait. The interesting part is that this study was done during the COVID pandemic, and we had to use a historical healthy control, and the median age of Dravet patients during this study was 31 years old. The healthy control was 62 years old, and unfortunately, all of the Dravet patients performed worse than a healthy 62-year-old control. So that goes to show that the gait problems are severe. Last point is about vaccination in adults with Dravet syndrome. So it's very important that they do get vaccinated. It should be given with careful monitoring, consider prophylactic antipyretics to avoid post-vaccine fever-induced seizures. The recommended vaccines include meningococcal, pneumococcal, annual influenza, and COVID-19, especially for those patients living in residential arrangements, group homes, HPV, and then TDAP, tetanus, diphtheria, and pertussis, which should be given once as adult, if not received as an adolescent, and then the boosters for tetanus and diphtheria every 10 years after that. In conclusion, seizures may become easier to control in adults. However, several other comorbidities decrease quality of life. We have to remember to ask about gait, sleep, appetite, and other comorbidities. We should not forget about vaccination, which is an important component of health maintenance in this population. And if you have any questions, please feel free to email me.